In tonight's KOTA Health Extra Smart Medicine,
Helene Duhamel tells us some things you can do to become a more informed, cost-conscious patient.
Total healthcare spending in the United States is expected to reach $4.8 trillion in 2021, up from $2.6 trillion in 2010 and $75 billion in 1970. To put it into context, this means that healthcare spending will account for nearly 20% of gross domestic product, 1/5 of the U.S. economy by 2021. Healthcare costs for American families in 2012 exceeded $20,000 for the first time. This is a good time to become a proactive, informed patient.
The old way was to go into your physician and in a paternalistic type of manner, you would just let them decide what the best treatment was and just go with it.
Not so anymore. Possibly the most crucial decision is choosing your doctor.
My humble opinion is that you choose the best person and ask friends, do some searching on the internet to see what other people have thought, and then collectively make an educated decision as far as who you might see.
A couple of weeks ago, I needed this cyst on my foot removed. As I was being pushed toward a surgical center, I continued to look for options. I wanted a more affordable office setting, local anesthesia, quick in and out. Some surgeries can be effectively performed in an office setting. Others require a surgical center or hospital.
Are we talking about a knee replacement, or are we talking about a cyst removal? The key is knowing, and certainly trusting your physician or surgeon. And as they say, do your homework before you have the procedure performed.
The computer is also a good place to start when picking your provider. Check their background and training.
Today, the internet is a very valuable source.
Health grades, even Angie's List and Yelp, rate doctors and facilities. But there aren't very many patients weighing in just yet. Dr. Greg Wittenberg got 5 stars on health grades, but only 17 people filled out a survey. You can also consider a consult, interviewing your physician. It's a good idea to bring up the subject of cost and effectiveness of treatment.
It should be part of the equation, certainly, in today's world and economics and the rising costs of health care. However, in the end, hopefully there can be a marriage between the two of a reasonable cost and the person that you want to see.
Come to the office with lots of questions and information. You're looking for a skilled provider that will treat you as an individual.
Can you swallow, please?
A patient who comes in who's 95 years old will have different concerns and needs than someone who comes in who's 35 years old and has a basal cell skin cancer on their nose. Be your own advocate, and it's your body, it's your health, and you're paying for it.
Potentially most important, look for a physician who listens to you and communicates well. Helene Duhamel, KOTA Territory News.
And remember, you have a choice of doctor and facility. Be a consumer and check them out before making a decision and putting your health care in someone's hands.